lecture today on diet and microbiota in health and disease. You focused on two aspects which are very, very interesting. The first one is, could the microbiome, as you have suggested, really influence atherosclerosis? Is this possible?
I believe so. I mean, this work has been done primarily in mice. So basically, the group that did the study, they saw that when they give them some kind of supplement in the diet, in this case it's choline, it showed that they had higher levels of basically atherosclerosis, or formation of these lipid in their blood vessels. Now, in human studies, we're not able to implement this kind of food into dietary intervention just yet, but based on association, it has been shown that people with a higher risk of heart attacks, stroke, they do have these higher levels of substances which came from the microbiota as well. That's related to the way they eat and what kind of food they
cannot metabolize choline, or what is it?
So it's actually the choline gets converted by the bacteria into a gas called trimethylamine, which then gets absorbed by us, and then our liver converts that into another molecule, trimethylamine oxide, and that is what is associated, what has been shown to be associated with heart disease. Yeah.
On another disease, IBD, always a hot topic for pediatricians, right, gastroenterologists. Anything new in the field of medical foods, or new oligosaccharides which we could use for prevention, or inducing remission, prolonging remission, or probiotics, new generation? Yeah. Anything new?
Well, we're working on it. For sure, we're definitely working on it. I mean, in Europe at least, defined formula diets are used fairly commonly, at least in the pediatric population and some adults as well. In the United States, not as much. We do know that these diets, they work well, but we don't know exactly how they work. So what we're currently working on is trying to figure out basically how they work in our body. Is it through our microbiota? Are they eliminating something that's in the regular food to help these patients get better? And I think once we have a better understanding of what that mechanism is, we will be able to design even better foods that's more palatable. Because as you know, most of these foods are not palatable.
Yeah, only the elemental diets are not the best, don't have the best taste, and you have to give them by tube. Yeah. But the other products, they are not so bad, let's say. Yeah. But these people have to tolerate a lot of things once they have the disease. And how about pro and prebiotics? Or next generation, as you said?
Yeah, exactly. So I think we're in the process of really being identify what kind of bugs are causing disease and what substances are these bugs producing that's causing disease. We don't know exactly all the details yet, but we are doing studies to try to understand that. And I think once we understand exactly what bugs are causing the disease and what are they making that's causing the disease, maybe we can use then prebiotics and probiotics, perhaps try to diminish those bad bugs and maybe increase good bugs to really to help these patients.
Okay, this is a non-invasive therapy, and you just have to take a little pill, 1 per day or 2 per day. That would be fantastic.
That definitely would be. Yeah, it's in the foreseeable future for sure. Yeah,
okay.
Yeah, that's our goal. Yes.
Thank you very much.
Yeah, absolutely. Thank you.